What if I told you at my last place of employment I had to look at people's behinds all day? Well, I did. And not only that, it was one of my favorite things to do, sticking people in the butt. Today, I'm going to show you how to give an intramuscular injection. Unfortunately, we won't be using the gluteal muscle today, but we'll be using the deltoid muscle instead. So the first thing you'll want to do is make sure you have a clean environment. You'll want to have all of your supplies ready. And of course, practice good hygiene, washing your hands with soap and water before and after. The supplies that you'll need will be your gloves, your medication, this is just a sample, your needle, Band-Aids, gauze, and your alcohol prep pads. And your syringe. This is the needle here, the barrel of the syringe, and the plunger. Okay, the first thing you'll want to do is take an alcohol prep pad, and you'll want to clean that stopper of that medication valve. You'll start in the middle, wiping your way outwards, and you'll want that to dry. You're going to take your syringe and you're going to do air to air. So if you're given 1 cc of medication, you'll draw up to 1 cc. Remove that cap and you're going to enter in your medication at about a 60-degree angle, bevel up, open side of the needle. And when you enter in there, you'll be at a 90-degree angle. Push that air inside. Then you're going to draw up your medication. You will actually, or it is a good idea to draw a little bit more than what you need. So I would go a little over the 1 cc. That way you would be able to get out any air bubbles. And normally we would just take a pin and knock out any air bubbles if we have any. They'll float up there to the top, and you can just push that needle until you get to the 1 cc line, getting those air bubbles out. You'll remove your needle from that valve. A recap, because you're going to change that needle. Never use the same needle that you drew medication up in. A dull needle will be more pain for the patient. So you're going to untwist that needle, removing it. Medication is still in that barrel. Replace with the new unused needle. And you will always do that, always replace that needle after drawing up the medication. Okay. Now, you'll want to locate your injection site. So to do that, you're going to find your acromion process, this bony area in the shoulder here. And you can use the V method, which you'll go right in the center of that. Or you can use 2 finger widths down, and it'll be right here in this location. So you're going to clean that area with an alcohol wipe, alcohol prep pad, in a circular motion. And you will want that alcohol to dry completely. And of course, you'll have on your gloves when you start this process and cleansing that area. Okay, so you will let that area dry. You don't want to give the patient any more pain or cause a stinging sensation if you enter in that syringe and the alcohol is still wet. So you'll remove the cap of that needle, and what you'll do, you'll pull the skin or use the Z-track method and slightly pull that skin a little bit taut, and you're going to go in almost like you're throwing a dart. And you'll only use the weight of the medication, never use your weight to push in a needle or a syringe. And you'll do almost like a dart motion, allowing that needle to go completely in because you don't want to go in too deep. So you'll just let the weight of that medication, never using your weight to push that in. Once you're in, you'll push down on that plunger completely, and all of the medication will enter in. You're going to pull that needle out at the same angle that you entered in. Okay? Recap. And if there's any bleeding on the patient, you'll gently use your gauze there. Remove that. And you'll have your Band-Aid ready. And just place it on the patient. And that was your deltoid injection. Of course, you'll clean your area, practice good hygiene as we stated before. And just remember, always use clean supplies, have your supplies ready. Make sure you have the correct medication, the correct needle size for your patient, and the correct needle size for the type of medication you're using. And also just relax, and I hope that some of these tips helped you, and good luck. Thank you.